Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
Well, it has been a subtle and glacially slow, but the tenor of economic experts describing our commercial state of things has shifted now from calling it a recovery to a patent economic expansion. Welcome again to the most widely watched source for the most crucial issues around Carolina business and public policy. I'm Chris William, and thanks for supporting us. Given the commonly quoted statistic that 5% of our population directly drives 50% of healthcare costs, and it's easy to see why the Affordable Care Act is so hotly debated. And this year, the capricious nature of the issue will continue to bend our 2014 business planning and capital investment. We will wade into all of these things concerning the region with our panel in just a moment. And joining us again later is the Chief Exec of the Palmetto State's Greenville Health, Mike Riordan.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. This edition of Carolina Business Review was recorded January 17th, 2014. On this week's program, Brad Dean of the Myrtle Beach Area Chamber of Commerce, Mark Hall from Wake Forest University, and special guest Michael Riordan, President and CEO of Greenville Health System. Now, here's Chris William.
Welcome to our program. Brad, good to have you here. Welcome.
Good to be back.
Mark, welcome. I don't know if this is going to be good for you or not, but we're glad that you're here and be in part of this.
It's great to be here, and it'll be wonderful for me.
Thanks, Mark. Okay, Brad, here's the thing. South Carolina, legislatively back in session. They started mid-January. What are some of the priorities? How do you think this year is going to unfold? Any dramatic changes?
Well, we're optimistic that some good things will happen. This is that time of year, Chris, when the Congress and the South Carolina General Assembly both reconvene. You get that uneasy feeling. It's like when a baby grabs a hammer. You know something's about to happen. You're just not sure how much damage is going to be done. We know they're going to talk about the gas tax and infrastructure funding. We're going to have to talk about the Medicaid issue. Thankfully, the budget outlook is much brighter in South Carolina, but it's also an election year. A lot of interesting things happen in election year. So we're optimistic that it'll be a productive year, particularly for the economic interests, but a lot of big issues on the table in South Carolina.
You know, I'm sorry, I really wish you wouldn't use that metaphor, but a baby with a hammer and the State House, you know, there's just a lot there. Okay, so this whole idea that South Carolina has refused any kind of Medicaid expansion, at some point, will the Palmetto State have to rethink that idea, and will they relent, do you believe?
I believe they're going to have to, Chris. It was a political decision, and I think a very uncomfortable argument last year for a lot of the legislators on both sides of the aisle. But this is not going away, and this issue is not going to go away, and arguably it's going to only become even bigger economically in South Carolina. And when it gets to the point where it's becoming an economic burden that's inhibiting job creation, we've got to step up and do the right thing. And sometimes the right thing isn't the comfortable thing, but that's why we elect leaders to do that.
Yeah, so Mark, you're listening to this dialogue.
Yes.
Wake Forest law, you know a little bit about health care, I would say more than the average person. For North Carolina and for South Carolina,
Right.
weighed in on this. Is this Medicaid expansion, will this have to be embraced eventually?
Well, I agree with Brad. It was a political decision. The policy arguments just don't hold water. And you have this situation that seems very untenable in the long run where our citizens are paying the taxes that are funding the Medicaid expansion in New Jersey and Connecticut and wherever else. So I mean, how can you justify that? Plus the hospitals are getting their funding cut to support the uninsured under the assumption that the Medicaid would expand, and they're hurting. So I think the forces are really aligned. Just added to that the basic fact that hundreds of thousands of people will be denied health care simply because they're too poor to qualify for these exchanges. So I do think the pressure is on to reconsider this, and whether it'll happen this year or the following year, I think the issue hasn't gone away.
Let me ask you about your leadership along the Grand Strand and the people that you talk to in the Palmetto State. When it comes to health care and health care spending and health care costs, what kind of anecdotal evidence are you hearing about businesses trying to plan around that and trying to get their head around what it's going to do to their bottom line and their top line?
Well, Chris, I think you emphasized the key word there is trying to plan.
Right.
And I think none of us really have a full grasp yet on the economic impact that this is having. We have heard anecdotal instances of businesses seeing their insurance rates going up 15, 20, 30%. But for every business that's seeing that, there's still a lot of businesses out there that just aren't sure, especially with the uncertainty in the exchanges right now. I don't think there's any question that costs are going up. The one thing we can all agree is that there's nothing affordable about the Affordable Care Act, but the exact impact and how businesses are going to feel and what the employees are going to feel still remains to be seen.
Do you hear anything differently when businesses talk about planning 2014 and beyond in healthcare?
I think the uncertainty theme is the big theme. Every year you hear about businesses complaining they're getting increases of double digits, but I think it's a transitional year where a lot of people are just holding with what they have to see what becomes available. And it's also true that the small business part of the exchange hasn't really been implemented this first year. That was put on hold for an extra year to try to get the main part of the exchange set up. So uncertainty is the guide word right now.
You know, Mark, especially in North Carolina, when you overlay on top of that the Republicans are clearly in charge in North Carolina, you've got that dynamic, you've got the fact that North Carolina is refusing Medicaid dollars, and then you've got this uncertainty. I don't want to say that's a perfect storm because I think that seems to be an overused metaphor at this point, but is that a serious problem that North Carolina needs to wrestle with?
Well, I'm not sure how much North Carolina itself can do. I think that people in the state, let me just make the following point, that the Affordable Care Act, really its main impact is on people without insurance and people who buy their own insurance. And that's only 25% of the population. So for those folks, going to the exchange is their main option, and that's now working a lot better than it was a couple of months ago. For everybody else, I think it is more or less in the wait-and-see approach, but I think they're able to go ahead and make some plans with respect to their workforce. Are they going to convert people to part-time or full-time? Are they going to try to continue benefits or move people to the exchange? Those things are starting to be evaluated.
Okay, Brad, give us a good ending here, at least on the first part of the program. Look to 2014 and beyond. We've seen some pretty good numbers expansionary. That gross state product and GDP looking good. Real estate, clearly South Carolina is leading North Carolina when it comes to rates of growth for real estate. How do you think 2014 will look when we look back on it? Better than 2013 and better than 2012?
Oh, I absolutely think it's going to be better than the previous 2 years. The question is how much and which sectors are going to see the most growth. Part of the reason South Carolina is leading North Carolina in that real estate growth is we were so far down before and had seen such a huge impact in terms of foreclosures and a lot of just depressed real estate, particularly in the coastal areas. So we're starting to see that come back. The best news of all, Chris, is prices are coming up, new starts are coming up, and foreclosures are down. I think we're going to see some steady growth in most of the base sectors, including tourism and real estate. And I'm most excited about the fact that in South Carolina, we are seeing new job growth through new industry being attracted to South Carolina.
And especially along what I like to call, certainly the Grand Strand, we've all called it many years, but the Gold Coast of South Carolina from just south of Wilmington all the way down to Charleston and beyond. some of those real estate prices got hit pretty hard because of the speculative bubble and the nature of that. Are we going to see some good news coming out of those properties?
I believe you are. In fact, I think we're already starting to see some of that come back. And now that the money is loosening up and lending is starting to free some capital up from the sidelines, there was a lot of money on the sidelines before, Chris. I think we're starting to see that come back in. And one great indication is you see along the coast of North and South Carolina, a lot of those large builders are now coming back into action. They've been out of the business, now they're getting back into the business. And that's a very encouraging sign, not only for the residential and commercial real estate markets, but just job growth and creation in general.
Yeah, okay, thank you. That'll be the last word. Bring our guest on in just a second. Next week on this program, very interesting. You know, you can't look at a news report or read an article without polling being part of that. The Humble Opinion Poll. Well, next week on this program, we will talk about politics and polling and how that has changed the way we not just talk about the issues, and not just how we report the issues, but how public policy leaders and business leaders shape their decisions. Polling and politics in the Carolinas. And then in 2 weeks, his name is Garrett Makita, and Garrett is from the upstate of South Carolina and heads a company called Proterra. He will join us as well in 2 weeks. In the last 7 years since arriving in South Carolina's upstate, our guest has taken the somewhat dusty but venerated Greenville Hospital to a shiny new brand with more alliances and progressive ideas to grow its business. Its business, though, as we've talked on this part of the program, is the oft-vilified sector of healthcare. We welcome back to this dialogue Greenville Health System President and Chief Executive Officer Michael Riordan. Mike, welcome to the program.
Thanks, Chris.
Mike, a couple weeks ago, and actually on this program, and in that chair you're sitting,
Right.
Tony Keck from DHHS in South Carolina has said that hospitals got it all wrong. They're being compensated to fill beds, and that's not the right model. Not just how do you respond to that, but does he have something there?
Oh, he's spot on. In 2008, we looked at what are the big things that are going to be occurring for us? What's the difference that's going to be happening? And we saw two big fundamental shifts. One was when it was unsustainable how much healthcare costs, and we were going to have to be paid differently. So right now we get paid fee for service. We do something, we hope it's good, we get paid for that. How do we get paid to keep larger groups, businesses, populations healthy? So that was one. The other thing we saw that was going to happen was workforce development. What are we doing to train that pipeline of the next generation? So I think he is spot on, and he's been a great partner for us at Greenville.
So how do you shift from this model of fee for service to saying there's another attorney with another hospital system that said to me privately, we got it all wrong in this country. We talk about healthcare, it needs to be well care.
Right.
The Chinese in the Chinese system, you pay your physician until you get sick, and then you withhold payment. Yeah. So how do we shift more toward that kind of motivation?
Well, I think we're seeing that in the marketplace already. So one thing's symbolically, we shined up the brand. We were Greenville Hospital System, now Greenville Health System, to sort of emphasize that wellness. The other thing is, what is the infrastructure you're putting in place to look at things more proactively? We think the world of case management, social work, of interacting with patients in a different way is really going to be significant. And then you put your toe in the water and you test stuff. So we've got 12,000 employees, 18,000 on our own health plan. What are we doing to encourage them to be healthy? So for example, this year, they've got to do a health risk assessment. They've got to do blood work. And what we've said to them, and we want you to have our insurance, but if you don't, we're not going to let you have our insurance. And then from that information, we can say, where do we direct our resources, whether it's diabetes, asthma, in the different things that our population needs. Or we're going to work with the state, Medicaid and Blue Cross. We're now managing 14,000 patients in the upstate, Medicaid patients, and we negotiated a lower price than what we had been getting in the past to put us at risk, to make us sort of think through the utilization. I think there's a little too much emphasis on unit cost in healthcare and not enough emphasis on utilization, and that's the shift that we're starting to see.
Yeah, Brad?
Mike, we often complain in South Carolina, particularly with some industries, about a brain drain. We see bright young kids who go to college and then they leave our state.
Yeah.
But in healthcare, and particularly in Greenville, it's been a brain gain. You're training a lot of doctors who stay in South Carolina. What is it that helps us keep those medical professionals in our state, and how do we do more of that?
Yeah, so thanks. I like this one. And when you think about when I said two things, the other one was that workforce development. So the first thing we did is, where are we going from a workforce standpoint? How are we going to train that next generation of caregiver? You look at the Affordable Care Act. If more people are going to have access to insurance, we know that there'll be more interactions with caregivers. We looked at the state of South Carolina. We ranked 40th in the 40s in terms of per capita number of primary care physicians. And our thought was, how do we grow our own? Now, we had been doing third and fourth year medical students with the University of South Carolina for 20 plus years already, and we said, do we take it to the next level? And Dr. Pastides and others, huge partners. And we actually know in South Carolina that if somebody sort of grows up in South Carolina, goes to medical school in South Carolina, then does a residency in South Carolina, 75% of them stay in South Carolina. It's really it's a number that's probably among the highest in the state. So that's sort of been our pipeline and our workforce development on the physician side.
Mark?
Yeah, Mike, I'm curious to hear more about your relationship with insurance companies. I'm hearing that there's a move back more towards selective contracting, where an insurance company might not include all the hospitals or health systems. And particularly as we move both to the public exchange, and now we're hearing about private exchanges where large employers let people pick their own insurance from a private exchange. So as the market starts to move that way, how do you position your system, or how do you see other systems in the area? Are they wanting to be sure that they're covered by all the products, or are they going to be more selective about who they partner with in terms of insurance carriage?
Right. I think, so what you're talking about, as I understand, is narrow networks.
Right.
And I think narrow networks are going to increase. And I think that's going to be driven, though, not so much from the insurance, but from businesses, because the business case, just like a large manufacturing company won't get rubber, perhaps they won't, they won't get multiple suppliers if they can get a good, reliable source. Or they're going to look towards what's a good supplier for something where we can get the bulk stuff, because they can drive down the pricing. I think you're going to see that from a narrow network standpoint for us. And I think the other conversation that's going to be happening in every state, not just ours, from a healthcare delivery standpoint is, do we become an insurance company too? I mean, you look at how things are blurring. You've got large employers like a BMW or a Michelin that are actually becoming providers. They have their own healthcare, mini micro systems.
Right.
You've got Blue Cross Blue Shield that owns doctors' care and other. You've got other states where the insurance company owns the hospital. And you've got some states where healthcare systems, like Kaiser or others, own insurance. I think you're going to hear more and more about how do healthcare delivery systems get further up the premium chain. How do you sort of control those and allocate those resources to get back to what Chris said? Then you can sort of really redirect and align incentives to get the behavior that focuses on prevention.
Well, and let's take that a little bit farther, Mike, because here we are, you're getting in the insurance business.
I don't want David Pankow to get nervous. It may be, it's a make or it's a buy. So do we work? What I'm saying is different relationships are going to have to emerge in a different way.
So, okay, better way, much more elegantly said than I blundered into that one. But my point is this, it becomes more of a free-for-all is not the right way, but it's the Wild West, or it's a new day.
Yeah.
And as more of that happens, and you've got insurers, selective contracts, and you've got like BMW and Boeing self-insuring and other large organizations, how does it, what happens to the end user? What happens to that person that's in the hospital? At the end of the day, not to overuse that metaphor, will they end up paying less for health care?
Yeah, so I think you're going to see, and this may sound like a subtle shift, but over time hospitals are not going to be viewed as revenue generators, but as cost centers. In fact, the way it will be reimbursed is that, and to a certain extent, if you need to go in the hospital, you're going to go, but that may be also viewed as a failure of the system. The economic incentive will be to keep people well so they don't need the hospital, rather than to get them well in the hospital, which is the most expensive venue. So I think it's going to be the alignment of how we're paid will drive different levels of behaviors and will drive utilization.
Yeah.
You know, Mike, you mentioned economic incentive, and that spurs a question in my mind. When most of us see a hospital system like Greenville Health, we instantly think of doctors and nurses and technology, but there's a whole level of economic development and expansion that's spurred by your industry that we often don't associate with. But you've taken a pretty innovative approach, almost creating a business incubator through Greenville Health. What are you doing that's having that impact, and what could other communities do to follow your lead in that regard?
Yes, so I taught in a great year from the chamber in relatively great city, Greenville. Part of civic duty is to be on the chamber, and I actually served as the chair of the chamber. And I thought it was going to be a check the box type of activity, and it was transformational for me to see the struggles of smaller businesses, which make up sort of the bulk of what's going on, and to see what the chamber was doing. We call it Next, and that's a collaborative private public or private dollars that were put in to sort of create that incubator, has just been a huge economic development. So our thought was, how do we direct those resources? We're a huge organization. Can we sort of create a space or an interaction that these micro biotech companies would be more inclined to come to us? And could we use what we're doing to be sort of an economic engine for the upstate? So I credit the chamber for helping me see that, and we're moving into that in a big way.
So Mike, I'm interested in, as you explain things, which I think you're right on in terms of what's coming down the pike. I'm not hearing a lot about because of Obamacare. I'm hearing because it makes sense, because this is what the purchasers want. And that resonates with me, because I think there's a tendency to say, well, this Affordable Care Act must be affecting everything and changing everything. I certainly hear that where I work. Well, because of the Affordable Care Act, we have to do this, we can't do that. But if I'm hearing you correctly, this is really stuff that is happening independent of that, or would be happening anyway, simply because of the economics of healthcare and the way in which these business structures are emerging.
Right. Yeah. So I talk to employees all the time, or groups, and everyone's going to have their preference. I mean, this is what an electric issue healthcare is. And what I say is, we're going to show up not from a place of being a victim at the effect of the federal government or at the effect of the state government. We're going to take responsibility for what we own, and we're going to shift the question from why is this happening to us and who's to blame to what can I do and how do I do it? And that'll be the conversation. And then publicly and wherever else, if there are policy issues, legislators are going to hear my ideas and thoughts on it, but I'm going to show up as a leader in an organization that if we can't figure this out, then shame on us. And I have a preference on how I would like things to go.
So when you huddle with your team, and South Carolina has clearly said no to Medicaid expansion, when you huddle with your team, how do you model what it looks like for you for revenue and the delivery of services, and how do you feel, do you think South Carolina will relent and will have to go down that road of Medicaid dollars?
Yeah, so from a how do I feel, the first thing we try to do is, all right, could the opposite of my story be as true and truer than my own story? So I think there's a way to go. Our state government is taking a different approach. So I listen to Tony Keck, who I've got a huge amount of respect for. And he'll say a few things. So just the whole publicity about the ACA has actually increased Medicaid enrollment in the current program. So that's a good thing. I like that. He says also, healthcare is inefficient. I would imagine there are very few of our listeners, your listeners, that would say, well, that's not true. Of course that's true. So what are we doing with the current dollars that are coming to the system to make sure that they're efficiently being run? So that's the programs he has. How are we looking at the un or underinsured? And he's actually putting in dollars to help look at that. And then the third part is, because there will be cuts from the Medicare program that we're going to be used to fund the Medicaid program, what are we doing there? So that is actually a lost revenue opportunity for us. And I'm willing to work on 1 and 2 really hard. And at the end of every meeting I'm with Tony Keck, I say, now if there's a way that South Carolina can come up with a waiver and do it our way, because we're innovative, we like to do it our way, but figure out a way to draw down those dollars, count me in, because I want to be part of that solution, and I'll work on 1 and 2 right now. So I think over time, This is not unprecedented. Medicare had a similar start. So if history is one indicator, it wasn't until the 1980s that the last state even joined Medicare. I think that was Arizona. So this is not unprecedented, and I think eventually we'll get into it. But for right now, I'm going to work with them.
In 15 seconds, you think if Tony Keck changes his mind that he can move the governor toward how he feels as well?
I don't know if that's how he thinks, but my gosh, I'll say a prayer for him tonight. I hope
Good Catholic boy. You're a good Catholic boy.
I'm a Catholic.
Yeah. Thank you for being on the program.
You're welcome.
And congratulations for everything you've done for that brand in
no,
the
it's been
upstate.
a
Good job, Mark.
great experience.
Yeah,
Thanks.
thank you. Thank you. Mark, welcome. Always good to have a demon deacon here.
Yes.
Nice to see you. Brad, always a good guy. Thanks for being here.
Always glad to join you.
Thank you, Brad. Till next week, I'm Chris William. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care, when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.com.